Hi, I'm Dr. Samantha. I'm a board-certified psychiatric nurse practitioner with over 13 years nursing experience working in mother-baby postpartum, NICU, antepartum, and labor and delivery. I'm also an IBCLC, I'm perinatal mental health certified, and I'm maternal newborn nursing certified. Your labor and the birth of your baby is one of the most important and memorable experiences you will have in your life. Birth plans are designed to help you communicate to your healthcare team what your preferences are during this labor and delivery process. So today we'll be talking about everything you ever wanted to know about what to include in that birth plan and what to leave out. So click those like and subscribe buttons and stay with us. We're going to start this video by me letting you know how I feel about birth plans. I really actually don't like birth plans. I think they set the stage for disappointment with women. I personally had a birth plan with my first child. It was this long 4-page convoluted document and nothing went according to my plan. And most of the time, nothing is going to go according to your plan. What happens with these documents is oftentimes they inadvertently limit your choices. Because a lot of people don't understand what they're asking for, they'll say don't do this and don't do that. So as healthcare providers, we try to honor that. Your language is so important in your birth plan. Make sure you avoid absolutes, not, always. These are things that make it very difficult for us to provide good care. And you need to understand your choices. A lot of times people will say stuff like, for example, don't give the vitamin K shot. And then in the labor room, they're asking what this is. We find that birth plans are actually very limiting, and I think they are too long. So in this video, I'm hoping you're gonna take what I'm saying seriously to design a very short, succinct plan that's easy for us to help follow. Pain management is one of the most important sections on your birth plan. The first thing you need to understand is you cannot ask us not to ask you to consent to pain management when you arrive in the hospital. We must get you to consent to pain management treatments ahead of time. When you are in excruciating pain, that is not a time to consent to anything. Of course, there are some emergencies that take place, but in general, if you are calm and comfortable arriving at the hospital, we need to get your consent for future pain management plans. This leads to the next part. Have a plan for pain management. In the hospital, we really truly will support your choice to have a natural labor, but sometimes labors can take a really long time. In fact, they can take up to 48 hours. And so what happens is over time, the pain might be too much, or your labor might be stalled because you're in so much pain. So you want to prepare for this ahead of time. Just because you look into your pain management options and list them as your alternatives does not mean we need to actively suggest them to you. It's just that everybody's on the same page if you should request them yourself. There are two types of fetal monitoring. Intermittent, which means every once in a while, and continuous, which means all the time. A lot of birth plans will include a preference for which type of monitoring that you would like to see us do. So the biggest thing I want to tell you is you need to let us monitor the baby. So it's important for us to know the pattern of your baby's heart rate. We also need to know how that pattern compares to your contraction pattern because that makes a difference on telling us whether you're having accelerations or decelerations. Now, one of the things a lot of people will try to do is limit the time. They'll say you can monitor the baby intermittently for 20 minutes because that's the time of an NST. But oftentimes in 20 minutes, we can't establish the pattern we need to see in order to know whether your baby is safe. So please allow for some leniency if you're requesting intermittent monitoring. Please remember to hit the like and subscribe buttons so you can get our latest content. Many birth plans will include a section about induction methods and anesthesia. So what you need to understand is there are different reasons that we use different medications. So telling us how to do your induction can actually interfere with the progress of your birth and might make it possible for you to be more likely to have a C-section than a vaginal birth. For example, some people will say, please do not rupture my membranes until I'm 10 centimeters. Well, when we rupture your membranes, the baby's head engages your cervix, which can make it easier for you to dilate. Also, a lot of times people will actually ask us to do that early before we use other medications. Once your baby's water has been broken for over 12 hours, this increases your risk of infection and pain, thus increasing your risk for a C-section. So telling us not to use stuff like Pitocin to allow your contractions to become regular can actually interfere. The other thing that I want to let you know is that a lot of times we are told what type of anesthesia to give you for your surgery. Basically, the two options that are commonly talked about are epidural versus spinal. Your anesthesiologist is going to look at your entire health history to determine the safest anesthesia for you. And telling us which anesthesia you're not going to take limits options and may make it seem to you like we're not listening when we're actually trying to advise the safest care. Let's talk about some bad ideas, things that I've seen in birth plans that I absolutely don't recommend. For starters, not having an IV, a saline lock. So just because we put the little IV catheter into your hand or arm does not mean you have to have IV fluids. But having IV access means if there is an emergency, we can give you emergency medications immediately. Also, sometimes you'll get dehydrated during your labor, and it's actually better and will help you progress if we are allowed to give you some IV fluids. Again, it doesn't need to be there the entire time, but it gives us the access ahead of time. Another thing I see is using your own clothes. So births can go super quick. They can be super long, but they can be super quick. If there is an emergency and you're in your own clothes, we're cutting those clothes off. We don't care what they are. And let's say it's not an emergency, but all of a sudden you go super quick. Birth is messy and we can ruin those clothes. Let us use our gowns, which are designed to take whatever beating they get. The other one I would say is not considering an enema. So when your colon is full of stool, it can sometimes prevent your baby from coming down into the pelvis, which can delay your labor. Sometimes an enema is actually a good thing because it can help to allow for more room for the baby to come down. And finally, refusing Pitocin after your birth. So we usually give Pitocin standard to help reduce your risk of having a postpartum hemorrhage. And that's because the Pitocin helps the uterus contract down afterwards, closing off those blood vessels. I'm not saying you have to just automatically take the Pitocin, but saying absolutely not means we're going to offer you other medications that actually have more significant side effects and might actually not work as well. Here are a couple things that I think are great ideas for your birth plan. Number one, asking for your epidural to wear off before you start pushing during a vaginal birth. A lot of times your anesthesiologist will try to make sure you have a really strong epidural during labor so that you don't feel any pain. But it's important to let some of that anesthesia wear off when it's time to push so you can feel what you're doing. Second, asking to avoid an episiotomy. This is a purposeful cut when you're having a vaginal delivery to allow for more space for the baby to come down. Episiotomies are not recommended except in emergency situations, so requesting that they avoid it is a good thing. And finally, once your baby's born, we often use an eye ointment to prevent eye infection. Asking for this ointment to be delayed until after your baby has fed, whether it's breastfeeding or formula, is very important in the bonding process. I hope this video has helped you learn how to create the perfect birth plan for you. Please share your comments and let us know what topics you would like to hear more about. Remember to hit the like and subscribe buttons so you can get our latest content in pregnancy, labor, and early childhood parenting. Share this video with your friends and family and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.